Okay, so you're getting ready for a community health worker interview.
Uh-huh.
That's great. It's such an amazing career, where you can really help people.
Definitely.
We've got all the RoleCatcher resources right here.
Okay.
Career guides, sample interview questions, even some info on how their AI can help you prep.
Mm-hmm.
So you ready to take a deep dive into all of this and get you feeling super confident to land that dream job?
Let's do it.
Awesome. First things first.
Okay.
What exactly do community health workers do?
Yeah. Yeah.
It's got to be more than like handing out brochures at a health fair, right?
Yeah, way more.
Okay.
Think of them as like health advocates, educators, and like that vital link between healthcare and the community.
Okay.
They're out there advising on everything.
Yeah.
From nutrition to prenatal care, even helping people quit smoking.
Wow.
And the coolest part, they work everywhere. Clinics, schools, people's homes, you name it.
So it's not a desk job.
Nope.
You're really out there on the front line.
Exactly. And often working in some challenging environments,
Yep.
maybe low-income areas or places with limited access to healthcare.
Yeah.
That takes a special kind of dedication.
For sure. And the RoleCatcher guide
Yeah.
definitely highlighted those challenges, but it also pointed out some really awesome benefits.
Mm-hmm.
Like the job outlook is really booming right now.
Absolutely. Projected to grow by 11% over the next few years.
Wow.
There's a huge push for preventative care and reaching underserved communities.
Okay.
So this is a field with a really bright future.
That's so great to hear. But let's be real. No job is perfect.
Right.
What are some of the downsides
Yeah.
that potential community health workers should be aware of?
Well, it can be emotionally taxing, You're dealing with real life struggles.
Right.
And that can take a toll.
Yeah.
Plus, the salary might not be as high as some other healthcare professions.
That makes sense. But I imagine the rewards are pretty unique too.
Oh, absolutely.
Yeah.
Seeing someone, make positive changes in their life because of your support, that's incredibly fulfilling. You're building trust, empowering people to take charge of their own health. You can't put a price tag on that.
Okay, so clearly this job takes a special kind of person.
Yes.
What key skills should someone highlight in an interview to show they've got what it takes?
Okay, so think about the core skills.
Okay.
Active listening, clear communication,
Mm-hmm.
both written and spoken.
Okay.
Being able to read people,
Yeah.
and that's social perceptiveness is key.
Got it.
And don't forget critical thinking. You'll be problem solving on the fly.
So important. RoleCatcher also mentioned persuasion.
Oh, yeah.
How does that fit into the picture?
It's not about being pushy,
Yeah. Right.
but you are guiding people towards healthier choices.
Mm-hmm.
And sometimes that means motivating them to overcome personal obstacles
Yeah.
or stick with a difficult change.
Okay, so it's like a gentle nudge in the right direction.
Exactly. Now let's dive into those interview questions.
Okay.
RoleCatcher provided a great list of common ones.
Awesome.
And remember, we want to spend about 75% of our time on this.
Okay.
Really helping you nail those responses.
Sounds good. I'm ready to get into the nitty-gritty.
All right, question number 1.
Okay.
Can you walk me through your experience working with underserved communities?
Classic opener. What are they really looking for here?
They want specifics.
Okay.
Not just vague statements. Think back to your experiences, volunteer work, internships.
Yeah.
Anything relevant.
Okay.
What challenges did you face? How did you overcome them? What did you learn?
So instead of saying I volunteered at a food bank,
Yeah.
I should paint a picture.
Yes.
Like, while volunteering, I noticed many people struggled with transportation to healthcare appointments, so I organized a ride-sharing program.
Exactly. Show initiative problem-solving skills.
Okay.
Be ready for follow-up questions, too. They might ask about specific interactions, how you adapted your approach based on cultural differences, things like that.
It's all about showing you can connect with people from all walks of life.
Absolutely. Okay, question 2.
Okay.
How do you prioritize the healthcare needs of a community?
Ooh, this sounds complex.
Yeah.
Where do I even begin?
Start by explaining how you assess those needs.
Okay.
Would you conduct surveys?
Uh-huh.
Analyze existing health data?
Okay.
Talk to community leaders?
Got it.
Once you've identified the needs,
Yeah.
how would you prioritize?
Okay.
Remember, resources are often limited, so you can't tackle everything at once.
Right.
So
if there's like a measles outbreak,
yeah.
that might take priority over, say, a chronic disease management program.
Right.
Even though both are important.
Exactly. Be prepared to explain your reasoning.
Okay.
What factors guide your decision-making process? They want to see a thoughtful, systematic approach.
Okay, moving on to question number 3.
Yeah.
How do you approach building trust with community members?
Ooh, good one.
This one feels huge for a community health worker.
You're absolutely right. Yeah.
Without trust, you can't be effective. So share concrete examples of how you've built relationships.
Yep.
What strategies work for you?
Yeah.
Are you a natural listener? Do you have a knack for making people feel comfortable?
Okay, so instead of just saying, I'm good at building trust, I could say, I find that being transparent about my intentions, actively listening, and showing genuine respect for people's cultural beliefs helps establish trust.
Perfect. It shows you thought about it.
Okay.
And have actual strategies.
Got it. All right, bring on question number 4.
Here it is.
Okay.
What experience do you have with health education and promotion?
Ooh, perfect.
Yeah.
I can talk about specific programs I've developed or been involved in.
Exactly.
What were the goals? What worked? Well, what did I learn?
Exactly. They want to see that you can apply those health education principles
Okay.
in real-life scenarios. Be specific.
Yeah.
Who was the target audience? What were the key messages? How did you deliver the information? Okay, so I could talk about like teaching seniors about healthy eating.
Yeah.
By partnering with a local grocery store to offer cooking demonstrations.
Love it. And don't shy away from challenges.
Okay.
Did you have to adapt your approach based on feedback? Did you face any obstacles in implementing the program?
Okay.
This shows you can learn and adapt.
Makes sense. Okay, question 5 is all about data.
Yes, it is.
How do you measure the effectiveness of a community health program?
Data is key.
Okay.
Show them you understand evaluation methods. How do you track progress? What metrics do you use to assess impact?
Okay.
Can you share any success stories backed by hard numbers?
So instead of saying the program was successful, I could say, after implementing a smoking cessation program,
Yes.
we saw a 20% decrease in smoking rates among participants.
Exactly. Numbers speak volumes.
Okay.
They want to see you're data-driven and can measure real results.
Got it right. On to question number 6. What experience do you have working with healthcare providers?
This one is key.
Yeah.
Collaboration is key in this role. So highlight your ability to work effectively with doctors, nurses,
Okay.
social workers, the whole team.
So I could talk about a time I collaborated with a local clinic to organize a free flu shot drive for the community.
Perfect. Be specific about your role and the outcome.
Okay.
Did you encounter any challenges in working with healthcare providers? How did you overcome them?
It's about showing I can navigate different perspectives and build those crucial partnerships.
Exactly. And remember, you're the bridge between the community and the healthcare system.
Right.
That collaboration is vital.
Okay, question number 7.
Yeah.
Can you discuss a time when you had to navigate a challenging situation with a community member?
Ooh, everyone's got a story about this, right?
For sure.
And they're not expecting perfection.
Okay.
Choose a situation where you learned something. Maybe a conflict you had to resolve, a difficult conversation you had to navigate. Explain what happened, the steps you took, and the outcome.
So I shouldn't pretend like I've never messed up.
Honesty and self-awareness are key. What matters is that you can learn from your mistakes and apply those lessons to future interactions.
That makes sense.
And don't forget to discuss what you would do differently next time.
Okay.
It shows you're reflective and committed to continuous improvement.
I'm realizing these questions aren't just about showcasing past wins,
Yeah.
but also about showing I'm a lifelong learner.
You got it. Every experience, positive or negative, is a chance to grow.
Okay.
All right, ready for question number 8?
Bring it on.
Here it is.
Okay.
Can you discuss a time when you had to advocate for a community member's health needs?
Okay.
This is where you showcase that passion for making a difference.
What kind of situation would be a good example?
Think about a time you had to go above and beyond for someone.
Okay.
Maybe you helped them navigate a complex healthcare system or fought for access to a service they were denied.
Right.
What obstacles did you face? Yeah.
What strategies did you use? How did you empower that person?
So if I helped a family enroll in a program
Yes.
they were initially deemed ineligible for,
Yeah.
I'd highlight the steps I took, the communication involved, and how I advocated for their needs.
Exactly. Show them you're a fighter, you don't give up easily,
Okay.
and you're dedicated to making sure people get the care they deserve.
Got it. Okay, on to the last question in this set.
Right.
How do you approach developing partnerships with community organizations?
This is so important.
Yeah.
It's all about building that network of support.
Right.
What steps do you take to identify potential partners? How do you cultivate those relationships? How do you create win-win collaborations?
So I could talk about a time I partnered with a local food bank
Yes.
to provide nutrition education to their clients.
Okay.
I'd explain how I identified the need, approached the food bank,
Uh-huh.
and worked together to create a program that benefited both our organizations.
Excellent. Highlight the benefits of the partnership, the impact it had.
And the lessons you learned along the way.
Okay, we've covered a lot of interview questions.
We have.
But before we move on, I'm curious,
Yeah.
what about career advancement?
Yeah.
Is this job a dead end?
Okay.
Or are there opportunities to grow?
Definitely opportunities. You could move into leadership roles like program manager or supervisor.
Wow.
As you gain experience.
Yeah.
You might specialize in a particular area,
Okay.
like mental health or diabetes management,
Got it.
or even go for further education. A master's in public health opens up even more doors.
That's great. RoleCatcher mentioned certifications too,
Yeah.
like certified community health worker
Mm-hmm.
or mental health first aid.
Yeah,
Do those really make a difference?
absolutely. They show you're committed to professional development
Okay.
and can give you an edge in the job market.
So it's not just about getting the job, it's about where you can go from there.
Exactly.
I'm loving all these insights. But we still need to talk about how RoleCatcher's AI can help with all this.
Oh.
I'm intrigued by how tech can actually personalize my prep.
That's what we'll dive into next. So stay tuned as we explore how RoleCatcher can help you tailor your answers
Awesome.
and stand out as the ideal candidate.
Can't wait.
Welcome back. So we've tackled those common interview questions.
Yeah.
But let's shift gears a little and talk about like the special sauce. You know, those core skills and knowledge areas that really make a community health worker stand out.
Okay, so we're talking about the superpowers.
Yes.
That'll help me nail this interview.
Exactly. Let's start with social perceptiveness.
Okay.
This is more than just being like people-friendly.
Right.
It's about reading those subtle cues,
Yeah.
both verbal and nonverbal, that reveal what someone might be thinking or feeling, even if they don't say it directly.
So it's like being a people detective.
Yes.
Picking up on those little hints that tell you what's really going on.
Exactly. And remember, as a community health worker,
Yeah.
you'll be working with people from all walks of life, each with their own way of communicating.
For sure.
Being able to tune into those nuances helps you build trust and tailor your approach.
Okay, that makes sense. But how do I, like, demonstrate this in an interview?
Yeah.
It's not like I'll have a client interaction right there in the room.
True, but you can illustrate it through stories.
Okay.
Think back to a time you noticed someone was hesitant, maybe, about joining a program or sharing personal information.
Okay.
How did you use your social perceptiveness to understand their concerns and approach them with sensitivity?
So if I notice someone was, like, getting fidgety when I mentioned vaccinations, I could talk about how I gently acknowledged their potential concerns and offer to answer any questions they had.
Perfect. It shows you're attuned to those nonverbal cues.
Okay.
And can adapt your communication style accordingly.
Makes sense. Now, let's talk about active listening.
Yes.
Another crucial skill.
Oh, absolutely.
It's more than just hearing words. It's about truly engaging with the message, both what's spoken and the emotions behind it.
It's like empathy in action.
Exactly.
Making sure you're not just waiting for your turn to talk.
Right.
But really absorbing what the other person is saying.
For sure, active listening means asking clarifying questions.
Yes.
Summarizing to make sure you've understood correctly. And responding in a way that shows you've truly grasped their perspective.
Exactly.
But how do I convince an interviewer that I'm like a proactive listener?
Yeah.
It's not as tangible as, say, knowing medical terminology.
Think about situations where you had to like resolve a conflict, counsel someone, or build rapport with someone who is initially resistant.
Okay.
Did you use those active listening skills to de-escalate the situation, find common ground, and build a bridge of understanding?
For instance, I could talk about a time when I was working with a community member
Yeah.
who was frustrated with their lack of progress
Okay.
in a weight management program. I could explain how I used active listening to validate their feelings, understand the barriers they were facing,
Okay.
and collaboratively come up with a revised plan that addressed their specific needs.
That's a great example. It shows not only your listening skills,
Okay.
but also your ability to problem solve.
Right.
And empower individuals to take ownership of their health journey.
That's awesome. Now, let's talk about communication.
Yes.
And I don't just mean being a chatterbox.
Right.
This is about communicating clearly concisely and effectively, both verbally and in writing.
This makes total sense because a community health worker is constantly explaining complex health information to diverse audiences, often with varying levels of health literacy.
Exactly.
You need to be able to break down complicated concepts into digestible pieces, tailor your language to your audience, and use different methods to get your message across.
So how do I prove I'm like a communication ninja in an interview setting? Should I start giving a presentation on the benefits of exercise?
Hold off on the impromptu lectures.
Okay.
There are subtler ways to showcase this skill.
Right.
Think about times when you've had to explain a tricky health concept to someone who had little prior knowledge.
Okay.
Did you use analogies?
Yeah.
Visual aids? Real-life examples?
Okay. So I could talk about a time when I was teaching a group of teenagers about the risks of STDs.
Okay.
I could explain how I used a simple analogy comparing the spread of infection to a game of tag to make the information more relatable and engaging.
That's fantastic. It shows you can think creatively and adapt your communication style to resonate with different audiences.
That makes sense.
Okay.
Now let's move on to another important piece.
Okay.
Understanding human behavior.
This sounds more like psychology class than community health.
Right.
It's definitely connected, but this isn't about textbooks. It's about applying those principles to real-world situations.
Right.
Understanding what influences people's health choices, their cultural backgrounds, socioeconomic factors, even their personal beliefs, helps you develop more effective programs and tailor your messages to resonate.
So if I'm working with a community where traditional remedies are highly valued, I need to be sensitive to that.
Yes.
And perhaps incorporate those beliefs into my health education process.
Knowing those factors can lead to mistrust and make your efforts less effective.
Yeah, that makes sense.
Yeah.
Can you think of a time when you had to adapt a program or a message?
Oh, yeah. Lots of times.
Okay.
Based on cultural considerations.
Yes. I once worked on a nutrition program.
Okay.
For a community where fresh produce was scarce and expensive. Instead of focusing on recipes with lots of fruits and vegetables, we focused on affordable, culturally relevant ways to add more nutrients to their existing diet.
That's a great example. It shows you understand those real-world barriers. And can adapt your approach to be culturally sensitive and truly beneficial.
Awesome. Now, let's talk about understanding healthcare systems.
Okay.
And I'm not talking about memorizing every medical procedure.
Right.
So what aspect of healthcare systems do I need to be an expert in?
Think of yourself as a healthcare navigator, someone who can guide community members through the often complex and confusing world of healthcare.
Right.
This means understanding things like insurance coverage, different types of providers, referral processes, and even how to advocate for clients within the system.
This sounds daunting. I'm not sure I know enough about the intricacies of the healthcare system to be like a reliable guide.
Don't worry.
Okay.
It's about demonstrating a willingness to learn and a problem-solving mindset.
Right.
Think about a time when you had to help someone navigate a tricky healthcare situation.
Okay.
Maybe you had to research eligibility requirements for a program or troubleshoot an issue with insurance coverage. What steps did you take? What resources did you use?
I once helped a senior citizen figure out how to get their medications covered under a new prescription drug plan.
Okay.
It involved a lot of phone calls, online research, and even a visit to the pharmacy to advocate on their behalf.
Wow.
It was a bit of a maze, but we eventually got it sorted out.
That's fantastic. It shows you're resourceful, persistent, and willing to go the extra mile to help someone access the care they need.
Awesome. Now let's touch on the final area.
Okay.
Understanding community development.
This is a big one. This is about recognizing that health is more than just physical well-being. It's intertwined with social, economic, and environmental factors.
It's like seeing the bigger picture. Right.
Exactly.
Recognizing how poverty, access to education, even safe neighborhoods all play a role in health outcomes.
This awareness helps you develop more holistic and sustainable programs, build partnerships with other organizations, working to address those broader issues, and advocate for policies that promote health equity.
So how do I showcase my community development savvy in an interview? Should I bring a PowerPoint presentation on the social determinants of health?
Save the presentations for another time.
Right.
Think about times when you've been involved in projects that address those broader community needs.
Okay.
Have you worked on initiatives to improve access to healthy food options in a food desert? Or perhaps advocated for safer walking paths to encourage physical activity?
I once volunteered for a community garden project in a low-income neighborhood.
Awesome.
It was a great way to bring people together, promote healthy eating, and beautify the neighborhood all at once.
That's great.
It really opened my eyes to the power of community-driven solutions.
That's a wonderful example. It shows you understand the interconnectedness of health and community well-being.
Okay.
And that you're passionate about creating positive change at a grassroots level.
Wonderful. And that brings us to our final segment.
Yeah.
We're not done yet.
Almost.
My brain is already overflowing with interview prep.
Just one more piece of the puzzle, and it's a game changer.
Okay.
Remember all that talk about RoleCatcher's AI?
Yes.
Well, it's time to dive into how their tech can actually help you tailor your answers.
Awesome.
And really shine in that interview.
Okay, so we've explored those core skills. We dissected those common interview questions. My brain is officially in community health worker mode.
Awesome.
But we can't forget about RoleCatcher's AI.
Right.
I'm ready to see how tech can actually level up my interview game.
It's pretty impressive.
Okay.
RoleCatcher offers a whole suite of AI-powered tools, designed to help you personalize your prep. We're talking tailoring your resume, practicing your answers, even getting noticed by the right employers.
Sounds like a personal career coach, but digital.
Exactly.
That's so cool.
Imagine this. Their AI analyzes job descriptions.
Okay.
And tells you precisely which skills to highlight in your resume and cover letter.
So instead of me spending hours trying to decode those sometimes vague job descriptions, I could let RoleCatcher's AI do the heavy lifting.
You got it.
Awesome.
And it goes way beyond just resume help.
Okay.
RoleCatcher's AI can also analyze your interview answers and give you personalized feedback.
That's amazing.
Like it can tell you if you're rambling, using too much jargon, or not giving enough concrete examples.
That's next level.
Yeah.
That's like having a virtual mock interview with an expert who can tell me exactly where I need to improve.
And you can practice anytime, anywhere.
That's so convenient.
No need to schedule anything or feel self-conscious about practicing in front of someone.
So I can polish my answers, test my confidence.
Yes.
And walk into that interview feeling like I can handle anything they throw at me.
Exactly. And here's another cool feature.
Go.
RoleCatcher has this database of employers who are actively looking for candidates.
Okay.
You can opt in, and their AI will match your skills and experience with potential job openings.
Wow.
Even help you get on recruiters' radar.
So it's not just about me applying for jobs.
Right.
It's about the right opportunities finding me.
Precisely.
I like that.
RoleCatcher helps you stand out from the crowd.
Okay.
And increases your chances of landing that dream job. Think of it as your secret weapon in the job search.
This all sounds incredible. I'm starting to see why RoleCatcher is such a game changer for job seekers.
Yeah.
But even with all this amazing tech, I can't forget about the human element, right?
Absolutely. Technology is a powerful tool.
Yeah.
But remember, you're connecting with a real person in that interview.
All right.
Your personality, your passion, your genuine commitment to this work. That's what will truly make you shine.
It's about showcasing my heart, not just my perfectly crafted answers.
Yeah, exactly. Yeah. So while RoleCatcher can help you polish your presentation and refine your responses, remember to bring your authentic self to the interview.
Got it.
Let your enthusiasm and dedication shine through.
Well said. As we wrap up this deep dive, any final thoughts to leave our listeners with?
Remember, becoming a community health worker is more than just landing a job. It's about answering a calling to serve others, to empower communities, and make a tangible difference in the lives of those who need it most.
It's about being a voice for the voiceless, a connector to vital resources, and a champion for health equity.
So as you prepare for your interview, think about the unique skills and experiences you bring to this role.
What makes me stand out from the crowd? What unique value can I offer?
Let those insights fuel your confidence and ignite your passion.
Love it. Go out there and make a difference.
We believe in you.
And that's a wrap on our Community Health Worker Interview Prep.
Deep dive.
That's it. We hope you found this journey informative, empowering, and maybe even a little bit inspiring.
We hope so.
Remember, you have the potential to impact lives in a profound way.
You do.
With the right preparation, a whole lot of heart, and a little help from RoleCatcher's AI, you can ace that interview and embark on a truly fulfilling career.
Best of luck on your journey.
Yes.
We can't wait to see all the amazing things you'll accomplish.